to part 3 of Internal Medicine 2014 Krok basis. So we have this patient, this infectious disease question. But so straightforward, there's something peculiar about this case. Pain in calf muscles. There's just one thing coming to my mind in this kind of condition. It's leptospirosis. Pain in calf muscles. Patient was fishing 2 weeks ago. They tell us something about fishing that has to do with water body. So it's leptospirosis. Others are gotten from uncooked milk and so on. So in this particular case, we have a 60-year-old woman, mother of 6 children, who is having right upper condyle tenderness together with fever, and patient has jaundice. Actually, when you see a triad of jaundice together with fever and right upper condyle tenderness, it is referred to as the Charcot triad. And most of the time, you notice the bile duct is affected, a condition of cholangitis, and patients that are fat over the age of 40, a female, and that is fertile, that have more than 4 children, you think of cholelithiasis. So, 42-year-old woman suffering from bronchial asthma, they're just asking us, what should you not use in first aid? They're not asking, what can you not use in asthma? They said, in first aid. So you don't want to use something that is long-acting and so on, like Euflin. Here we have, okay, I'm going to say something about pulmonary disorder in this particular aspect. They're telling us about a patient that is having dry cough and so on, but notice that data of percussion is showing vesicular breathing that is weakened below the angle of right scapula. This could also be re-rating as dullness on percussion. So any condition that causes like a consolidation, that is like a thickening in the lungs, is going to cause dullness, such as pneumonia. So this patient is having pneumonia. So when you think of vesicular breathing, it's that of pneumonia. This particular patient is having signs of leukemia. Which one in particular, we are not very sure, but they are telling us that lymphocyte is 72%, way above normal. So what other test should you do? So we are thinking maybe of chronic lymphocytic leukemia or so, but we don't know from this particular question. What method of study should you use to specify the diagnosis? According to Krok, the answer is myelogram, but myelogram is an examination of the spine. I don't know why it's myelogram. Please, if you know, you can simply comment below. So we have a patient with sinusitis, pulling discharge from left nostril, mucous membrane of left nasal cavity is red and turgescent, like swollen, purulent exudate in the middle nasal meatus in maxillary. Actually, the frontal sinus opens into the middle, maxillary sinus into the middle. So we have the clue from the question, middle meatus in maxillary, together with the region that is being said the patient, the purulent exudate is in the middle meatus in maxillary. So you simply go for this. Anytime they give you a question like this and you can actually point out what is the cause of the respiratory attack, think of something that is allergic. If you can recognize the cause, think of something that is allergic. So in this particular patient during a stay on the countryside, that's it, and further attacks occur while cleaning the room from dust. So this is an household allergy, something of allergic reaction, household allergen. The complications of acute cholecystitis which require surgical intervention are all of the above except jaundice. What do you want to do in jaundice? You want to remove all the layer of the skin? Surely no. So in empyema, gallbladder perforation, cholangitis, emphysematosis are urgent surgical cases. So except in jaundice, you don't do surgery. Again, patient is having allergic reaction based on application of cosmetic face cream. So something external, something can actually remove and the patient be able to recover from that. You think of an allergic condition. So this allergic dermatitis. Okay, for those that are very good in psychiatry or psychology, I might need your help here. But one thing about this particular patient that is having schizophrenia means scattered thoughts. Schizophrenia means thoughts, schizo means scattered. And is thinking that he's an outstanding scientist. Don't think that you're having schizophrenia. Don't worry, continue to dream big. But if you have to think that somebody wants to poison you or jealous of you, then it might become a very, very serious condition. And that is paranoia. Like when you have delusions of persecution and you are exaggerating your self-importance. That is like paranoia. But I don't know why it is not paranoid, and the answer is paranoic, the one with IAC rather. So this is a patient that is highly dependent on alcohol, who have not consumed alcohol for 2 days. So when you hear of any maybe psychological disorder and the patient is dependent on alcohol, so just go ahead and start thinking of, as far as Krok is concerned, of alcohol delirium. So this is delirious. If you read through this particular case, you will notice something that's actually back pain. Back pain, dark urine is usually common for hemolysis. But what's causing the hemolysis in this condition, we are not very sure, but we can suspect just one thing. Patients, after treating like a cold, maybe you are thinking of something viral with aspirin. So aspirin plus recent viral infection produces what is called like Reyes syndrome in patients that are susceptible to that. So the most likely answer in this condition is acute on the acquired hemolytic anemia. Don't forget that these are signs of hemolysis. You can see the red blood cell color index is 0.9. It's not really the fact that patient is losing iron or patient needs enough iron. Collagen is normal, but it's due to hemolysis. You can see the red blood cell is low, and these are signs of hemolytic anemia. So it's acquired hemolytic anemia associated with Reyes syndrome. This patient is having pulmonary tuberculosis and all of a sudden developed chest pain and dyspnea at rest. So we are thinking of something, since it's sudden, he said acute pain in the right house. So you are thinking of a process that must have caused air to escape from the lungs into the pleural space, and that is usually a complication of pulmonary tuberculosis, which is a spontaneous pneumothorax. Based on the history of these patients, it's spontaneous pneumothorax. Pleuritis seems more likely, but also likely, but they are telling us that the patient has a history of pulmonary tuberculosis. So the best option there is spontaneous pneumothorax. Again, this patient is having have been taking alcohol for over 3 years, and that is what is causing this psychosis that we have here. Again, delirium, alcohol delirium. So another name, delirium alcoholicum. So we have a patient that is suffering from benzene poisoning. Majorly, benzene poisoning causes narcosis. Patient is dizzy, feel like sleeping everywhere. And since you are treating the patient as an inpatient, when a patient improves in almost all conditions, what do? You send them home and monitor them as outpatients. The same thing in this condition. All right, we treated something like this in part 1. This is a patient with hemophilia. How do we know? There's spontaneous bleeding into the knee joints, and you will discover that even though the blood parameters are normal, since the patient is about to undergo surgery, definitely there will be bleeding. So what do? You want to transfuse certain clotting factors. How do you transfuse that? Through fresh frozen plasma, and you can find that in the option. That is also like cryoprecipitate, fresh frozen plasma. Please don't mistake it for the dried blood plasma. It's fresh frozen plasma, so that's a cryoprecipitate. So we have a 44-year-old patient. This is a urological disorder. Notice difficulty urination. So the disorder is not really at the level of the kidney. So let's see. Sonography, that is ultrasound, revealed that there is hypergogenic formation that was changing its position. In fact, this is the stuff pointing us to the right answer, changing its position. It means that whatever it is that is changing position is not directly attached to the organ in question, in this case the bladder. So the answer is, this means that it's a stone. Stones can change position, and they are usually hypergogenic, but to just save us some grammar, it's changing position. That's a concurrent. And I want to say something here. The bigger the question, many times the simpler the answer. Don't think too much. Think as simple as possible. This is a boy that is having signs of meningitis and so on. But the father has a history pulmonary tuberculosis. Very simple. So all these other results that we have from cerebrospinal fluid analysis and so on, you may not want to waste much of your time anymore. This is tuberculous meningitis. So we have a 35-year-old patient. We have pain and morning stiffness of hand and temporomandibular joint over 30 minutes. These symptoms have been existing for 2 years. See, anytime they are telling you of a musculoskeletal disorder and the question is what examination do you administer? If it's a musculoskeletal disorder, the first thing you should think of is to do an X-ray. That is, this also means X-ray, röntgenography. So röntgenography of hands. We have a 69-year-old female patient with fever, temperature 38.3, hematuria. In fact, almost all the conditions here can actually cause hematuria, maybe not really in polycystic renal disease. ESR is elevated in conditions of inflammation, but when it is so elevated, this is so elevated. So this is 55, is highly elevated. We are thinking of cancer with hematuria, cancer.